Hello. Today we are going to be teaching about the drug digoxin. Digoxin is a cardiac medication derived from the plant foxglove. Its classifications are cardiac glycoside and inotropic, and the therapeutic classes are cardiac glycoside and antiarrhythmic. Digoxin is a heart medication taken for rapid digitalization and for maintenance therapy in congestive heart failure, atrial fibrillation, atrial flutter, and paroxysmal atrial tachycardia. It also helps to support blood pressure. It acts by inhibiting the sodium pump, which allows more calcium to be used in the myocardium and conduction system. This results in an increased strength of muscular contraction of the heart, as well as the number of contractions, and reduces the amount of time it takes for muscular contractions of the heart to occur. Digoxin can be given with or without food. The available routes include oral, intramuscular, more specifically the gluteal muscle, and intravenous. If given orally, it is to be given on a consistent basis with regard to meals. For rapid effect, a larger initial loading or digitalizing dose should be given in several divided doses over 12 to 24 hours. Maintenance doses are determined by renal function and will be evaluated by individual response. Doses required for atrial arrhythmias are higher than those for inotropic effect. If a client has difficulty swallowing, then there are oral tablets that can be crushed and given with food or fluids. Absorption may be slightly delayed if administered after food, but the total amount absorbed is not affected. If you were to give digoxin intramuscularly, instructions are to massage the site to reduce pain and to not give more than 2 milliliters of digoxin in each intramuscular site. Regarding intravenous injections, digoxin can be given undiluted or diluted with 1 milliliter digoxin in 4 milliliters sterile water for injection, dextrose 5% in water, or 0.9% sodium chloride. Necessary monitoring and/or follow-up include taking the apical pulse for 1 full minute, noting the rate, rhythm, and quality before administering the drug. Notify the prescriber and withhold medication if apical pulse falls below ordered parameters, which is less than 60 beats per minute. Be familiar with patients' baseline status such as quality of peripheral pulses, blood pressure, clinical symptoms, serum, electrolytes, creatinine clearance as a foundation for making assessments. Monitor for signs and symptoms of drug toxicity. Monitor intake and output ratio during digitalization, particularly in patients with impaired renal function. Monitor for edema and auscultate chest for rales. Monitor labs, baseline and periodic serum digoxin, potassium, magnesium, and calcium. In adults and older children, the first signs of toxicity usually include abdominal pain, anorexia, nausea and vomiting, visual disturbances, bradycardia, and other arrhythmias. If these appear, withhold digoxin and notify the healthcare professional immediately. Treatment for life-threatening arrhythmias may include the administration of digoxin immune Fab Digibind, which binds to the digitalis glycoside molecule in the blood. For electrolyte imbalances, administer potassium so that the serum potassium is maintained, and monitor ECG for evidence of potassium toxicity. That is the end of our PowerPoint. Thank you very much for watching.